Hi, everybody. We're going to get started in just a few minutes. Just a reminder, please grab lunch. And on the top of your agenda, you have a QR code. Please scan that QR code and sign in so we know you're here.
We're going to get started in about 2 to 3 minutes if you want to make sure you have lunch and a seat. All righty, everybody, it is 12:45. So let's go ahead and get started. Thanks for coming to the Safety Net meeting today. I'm Linda Bates with WellCare of Kentucky, and I sit on the Safety Net Alliance Engagement Committee. So part of that is getting to be the MC for the day. So if you have ever wanted to be an MC, sign up for the Engagement Committee. We'd love to have you join us. So today our panel will be focusing on recovery, but we'll get to that in a minute. First, what I'd like to do is invite any new or first-time attendees to introduce themselves and tell us your name, organization, title, and if there's anybody in particular that you would like to meet today. So, is there music going on behind me?
Sorry about that.
That's all right. I only MC, I don't dance. So, okay, let's start with who wants to go first to introduce themselves. Okay.
Good afternoon. I'm Beth Sewell. I'm one of the 3 Kenton County commissioners that serve in this county. And I was invited today by Laurel Allen, and so it's my pleasure to just learn about this organization. I know most of, and we're involved with several of the organizations that are partners within the group. So it's sweet to see you all come together. As the county, we have a special account that that you can apply to as a not-for-profit and receive funding through it. And so several of the organizations that are part of your team here have done so. So we like to see that there's, what's wonderful about this is that hopefully you're eliminating redundancy and you're really working together to try to find the most and best efficient ways to serve your clients. So I appreciate that very much. Thank you.
Thank you. It's nice to have a commissioner here, county government. Yeah.
Hi, everyone. I am Sister Tracy. I'm a Sister of Charity of Cincinnati, and I started working at St. Vincent de Paul, Northern Kentucky, a few months ago. I'm working in the assistance office as the bilingual outreach associate. So if you have Spanish-speaking folks that call our helpline, I will be able to serve them in their language. And I also accompany Vincentians on home visits to interpret. So I'm interested in connecting with anyone serving the Spanish-speaking community and immigrants. So thank you.
Thank you.
Hi, I'm Claudia. I'm with Free Store Food Bank, and I'm with the workforce development side of Free Store. So I just wanted to come out today because I kept getting emails, and I was like, I've never attended one in person, so it's nice to meet some of the folks that have reached out, and hopefully we can bridge the community and see where we can fit in.
Hello, my name is David. I'm with People Working Cooperatively. We're a nonprofit located in Cincinnati. What we do is we do emergency home repairs and services for low-income households at no charge to them. Our services go as far north as Dayton, Ohio, and go as further south as Gallatin, Pendleton, and Grant. I work in client services, so our department is essentially the first line of contact for our clients' needs. And I'm just very happy to be here today and see what this has to offer. So, thank you.
Thanks for being here, man. I see you starting to stand.
Hi, my name is Micah Taylor. I'm a connector with Northern Kentucky Community Action Commission. This is my first time here, but I'm really excited to be here, meeting everyone, and just kind of seeing what it's all about. But I'm looking forward to just meeting with people who have just connections with just people who need just Medicaid help, SNAP benefits, child care assistance, and such as. So, thank you.
Hello, my name is Beth McIntyre. I am with Go Pantry. I'm one of the co-founders and executive director of Go Pantry. So I'm thankful to be here today. I've never been and look forward to connecting with you guys. But for those of you that might not know what we do, we feed kids here in Boone, Kenton, Campbell, Grant, and Owen counties. We also go into Dearborn, Indiana, and we're doing the weekend food bags or boxes for kids over longer breaks. So we mainly work with schools and some other organizations that deal with mental health. So I'd love to meet anybody that we can connect and work together to help kids in this area. Thanks.
Awesome. We love Go Pantry. I'm glad you're here today.
That's good to see you again. Hi, everybody. My name's Nina. I work at Brightview as a targeted case manager. I'm here today. I've been in and out of these meetings for a little bit, changing organizations, but I'm here with Brightview. I'd love to meet people and love talking. Looking for housing resources, Social Security, kind of anything that'll help people meet their basic needs. So that would be a great opportunity.
Is there anybody else? There we go.
Hi, I'm Emmy Sargent. Sorry, I don't talk in microphones usually, so I don't know where it needs to be. I'm a coordinator, the Ready to Work coordinator at Gateway. Christina Powers invited me, if you know her. So my job is to help place students who are receiving KTAB benefits into the community to get some work experience and to meet their benefits. So if you have somebody in mind that you might want to host a student, reach out to me. I've heard of the Safety Net Alliance before in past jobs, and I've never been able to come, so I'm really excited to be here and network. So thank you.
We're glad you're here. I host Ready to Work students at the pharmacy, and they are amazing. And so please reach out if your organization can use some really quality people.
Hi, everybody. My name's Ashley Neltner. I am a care coordinator and social worker at the Life Learning Center in Covington. I'm sure a lot of you know what the Life Learning Center is and does. But anybody else I'd like to meet? We are also, always looking for housing, not just sober living. So if anybody has any resources on that. And word around town is October 28th, we'll be having our annual trunk or treat. So come on down.
Very good.
Hi, my name's Lindy. I am an RN care coordinator for St. Elizabeth Physicians. Specifically, I do kind of the hospital discharge follow-up calls, make sure patients and everybody's okay at home and they have all their needs met. I work with Laura Riggs. That's kind of how I figured or found this out. And yeah, I'm excited to meet everybody and hear what else is out there.
Thanks. It's good to see you again. I knew I recognized you, and I was like, oh. Care coordinators are heroes, by the way. If you don't know that, you should know what they do. They're pretty amazing.
Are there any other new first-time attenders? Well, thank you for coming. For those who are here for the first time, we're glad that you're here, and hopefully you'll make some great connections and learn that you should come every month. So with that being said, let's do some committee reports. So Aaron, would you like to do an executive committee report?
Sure. This is a weird month because the third Tuesday does not follow the day before the third Wednesday, so we do not meet until next week. We are continuing to work on our pilot that we're working with the United Way on. I know most of you know about it, but we're excited about it. The pilot is functioning and is going to be up and running soon. And really, it's all about how do we move people through the system faster and more efficiently. Also, on your agenda today, on the back of the agenda, there is a nomination form to nominate someone to be on the executive committee. We would love to have some people be on it. It is a wonderful experience. You meet amazing leaders throughout Northern Kentucky. We set the vision and direction for the Safety Net Alliance, which, as always, is always focused on how do we connect and how do we make services better for those in need? How do we get them to services easier? So we would love to have you nominate yourself or nominate somebody else. A couple things that we want to make sure that you know of. It says voting on bylaws. We did that last month. Sorry we didn't change it. But our bylaws now say that we can only have one person per organization on the executive committee. So, like Becky, sorry, you can't be on the executive committee because I'm on it. So if you already have somebody from your organization on the executive committee, then you wouldn't be eligible. And also, if two people from the same organization get nominated, we go to that organization and say, which one would you like your nominee to be? So that shouldn't mean that you shouldn't nominate. Just know that that's the way that we process. But we'd love to have some more people on the executive committee. We have some people flowing off. Get some new life and new vision and excitement going.
All right, thank you. Service integration, who would like to give an update on service integration?
Yeah, we had a meeting since we are past we had really focused on the past year for getting together the universal intake as part of the service integration committee. And so as that had wrapped up, the last meeting we really went back and looked at, what is this committee call to do, and so we're focusing on that. We've traded some reports on the various agencies and what all is available in the area. So we're focusing our next meeting, which is tomorrow, if anyone would like to join us, on kind of looking at next steps for the committee, actually. So that's kind of where we're at. Thank you.
Thank you.
Thanks, Chadwick.
Member engagement, Laura, do you want to do it?
Hi, I'm Laura. So for the member engagement, we've been working really hard to kind of make your coming in here wonderful and talking to you and saying hello and everything. But for our next meeting, we're really focusing on what we're going to do for meetings for next year. So if you guys have any ideas of any topics that you really like to cover, we're probably going to stay pretty true to what we did this time, but we're going to keep a lot of the same things. But if there's something that you felt like there wasn't enough representation for or you'd like to see more of, please let us know. We want that information. We want that feedback. Also, if you want to plan the events, know the people, have your name, like, I know these people, reach out to us or join the member engagement committee. We would always love more people to be part of it. You get to have fun and stand up here and talk to people and you know, engage with members. So it's a wonderful thing. So if you're interested, please sign on the back of that. But it's also, we really need other people's valuable input about who would be the best panelists, who would like to see up here. So please reach out to myself, Linda, Mary, I'm so sorry. Aaron's on it as well. So if you have anyone there, please reach out to us if you have anything that you would like to be added for next year.
Except for today's panel, because today's panel is the best panel. Yes.
Yes.
So you could not improve on today's panel, but maybe a past panel or a future panel.
All future panels, not past. So the other thing, too, is we do meet on the 4th Wednesday of the month. So we always meet the Wednesday after this meeting. So we had our meeting already, right? Okay. No, it's next, but for November. Community impact. Who wants to give community impact update?
We already, right there?
Nothing?
No updates?
No updates from...
And external relations, I don't think anybody from external relations is here today. So we're off the hook.
Sorry about that. Okay. So we're over with our community updates. And now I would like to invite the panel to come on up to the 4 chairs up here. We have Matthew Stahl with Sun Behavioral Health. Jennifer Schaffner with Transitions. Huh? I know. Math A.
Can I give this with you?
Christina Vickers with Peer Recovery, and Tina Guerrera, right? With PALS, Parents of Addicted Loved Ones. So why don't we go through, you can tell who you are and just maybe a tiny little bit about yourself and how you got to where you're at, okay?
Okay. So I'm Tina Guerrera, and I'm here representing PAL, which is Parents of Addicted Loved Ones. PAL is an organization that started in 2006 out in Phoenix, Arizona, by a gentleman named Mike Speakman. My husband and I have a son that has battled substance use for over 20 years, and we found PAL in 2015. That was started by 2 counselors in Catholic Charities in Latonia, and walked into the meeting that night and just knew that this is where we needed to be. Shortly after that, they asked us to facilitate the meeting, and we've been doing that for the last 10 years, and meeting a lot of people, and have also grown now to do 2 groups. So we have a group in Latonia that meets on Wednesdays, and a group in Florence that meets at Crossroads. So I always say that it saved us, our marriage, and probably our son. Thank you for letting me be here.
Good afternoon. My name is Jennifer Schaffner. I'm the Chief Development Officer with Transitions. I've worked for Transitions since 2016. I started a career working at a community action agency, and so big fans of community action, and really grew into caring about issues of homelessness and housing affordability, and ended up serving at Transitions on the team there, and consider it a privilege every day to work on behalf of individuals with substance use disorder in our community. And so Transitions provides drug and alcohol treatment for adults with substance use disorder, and we do that through a variety of ways. We provide residential treatment, outpatient services, and a lot of recovery housing and additional support that goes around that housing. So I know a lot of familiar faces here today and organizations that are here that we partner with, that you all serve and support the individuals that we serve, and so really glad to be here with you today. Thank you.
Try this one. Hey everybody, my name's Matt Stahl. I'm with Sun Behavioral Health. I'm on the business development team as a community liaison. I've been with Sun for going on 3 years now. I've worked in the field of substance use treatment and mental health treatment for the past 6 years. I got into the field because I'm in recovery myself. I've been sober almost 7 years now. I got started working in the field down in Georgetown and Lexington, Kentucky, running sober living facilities down there, and then also running a PHP and IOP with supportive housing down there as well. And then I kind of moved back up here because my whole family's up here, and I started to work for Sun. Sun is a 197-bed acute behavioral health hospital. As far as substance use, we do have a unit for substance use. We have a detox facility as well as a 25-bed 2-week acute rehab program where we do medical detox, and if someone's willing and motivated to want to change their life and remain sober, we offer them the opportunity to stay with us for 2 weeks, and we also offer a plethora of outpatient services as well. So yeah, here you go.
Thanks, Matthew. Hi, my name is Christina Vickers. I am the outreach coordinator for the Peer Recovery Community Center. I am up here based on my lived experience. Just recently celebrated 5 years sober, and don't do that. Because of the things that I have been through, I have gotten this far in my life, and I am able to go out into the community and help other people who are just like me. I am a Brighton alumni, and I am just constantly everywhere that I can get to reach out to the community. And at the Pier, we offer a safe environment for anyone who is experiencing mental health, substance abuse, or homelessness. And we provide a safe environment for them to come in, and we help them get connected to resources, and we can do anything and everything. And if we can't do it, we will find somebody that will. Thank you.
All right, thank you. Thank you guys very much for the introductions. So the first question that we would ask for you all is, what is driving the need for your services and that the community needs to be aware of? So is there, and that could be even trends if you want to include that in your trends.
Well, I think that what's driving it is still the need for, in our organization, for the support for the families. Sometimes the statistics look like things have gotten better, but believe me, they have not gotten better. And there's still a lot of families out there that are struggling with loved ones, that they don't know what to do, they don't know how to help. And being able to come together in a group where everybody is facing the same challenges and hear people going through the same thing as you, and just knowing that you're not alone. So I think as long as there's a drug that can be abused, there's going to be a need for us and for support in the community.
I think from our perspective, there's still a lot of stigma associated with substance use disorder. It's still really hard for individuals to ask for help. It's hard for families to ask for help. And so one of the things that we're pretty passionate about at Transitions is to come to events like this where we have the opportunity to share a little bit about what we do. But I would also say, you know, the other thing is that national statistics say about 5% of the population has a substance use disorder. So in Northern Kentucky, if that's about 400,000 people, you know, that's about 20,000 people. The good news is about half of those people are in recovery, but that still leaves about 10,000 people, roughly, that are in active addiction. And so I can tell you that we don't have 10,000 people showing up at Transitions for our services. So we think that there are still a lot of people in need in our community and in the greater Cincinnati region, and that's why we get up every day and come to work.
Well, with Sun, I would say that we meet people sometimes at the very worst part of their lives. They come in there in the middle of a crisis. They don't know what's going on. They've been drinking every single day for a number of years or using drugs for a number of years. And what we do very well on our substance use side is we provide them hope. We don't just stabilize them. Most of the people that work on our substance use units are all in recovery themselves. We have a therapist who's been sober since 1984. Both of our discharge planners are also peer supports. They're able to share lived experience with them on how they've gotten sober and the next steps to take. What I've realized is that a lot of people that come into Sun are a lot of times looking for us to help guide them on their recovery journey. And so what I think about the need that Sun has to help people in this community is it's a prevalent need with, full medical detox, like an actual alcohol detox. When people come in there, and maybe they're too high acuity to go to a residential because they need to be detoxed medically, and that's what they come to us for. And then when they come into us, they're met with, open arms and people that have been there in their shoes before. So that's something that we do very well, I think.
With the peer, just from my own experience, is when I experienced homelessness, going into a place like the peer with people who have had the same experience as me, who are in recovery, providing resources and access to take the next step into either moving into a sober living or into a treatment facility or seeking mental health attention. Because I was able to go in there and see people just like me, it made me feel more comfortable. It was a very safe environment, and it was peer-led. There was a lot of education, a lot of resources that guided me into the next steps that I wanted to take. And sometimes, just from my experience going into someplace, when I went to treatment, I was very scared. I was very intimidated by everyone who worked there and thought, okay, are they really like me? And it can be a scary situation. So anybody who is currently living on the streets or dealing with substance use, it can be a very scary world out there. And change for somebody like me is frightening. So for somebody to come into the peer and to talk to us and we can explain that we have lived experience and that we've been through the same fears and this is a step that we take to go into the next step of our journey, I think it makes them feel a little bit more comfortable. Also, the thing with the peer is that we do provide support groups. We do help with hygiene and different kinds of things if they need anything. And it is a very safe environment, and we experience all kinds of people who come in through the door, and they come from every aspect of life. Sorry, I'll talk too much, so sorry.
I do like the way that you talk about it being a scary situation, because if we can all just think about even walking into a meeting with 70 people and you don't know one person in that room, and that's, that can make all of us uncomfortable. And now we're talking about making a big change and just flipping your world upside down. So yeah, thank you for sharing that for sure. What are some barriers that you guys are experiencing? I know you mentioned stigma, which has been a barrier for forever, but what are some barriers that you're seeing that has an impact on your successes or that you're successful in spite of those barriers? What are some of those?
I'll go. So tossing it back. Some of the barriers that we do experience with peer obviously is funding right now. That's huge. But I have come to find out that there are a lot of places out there that don't realize that the peer even exists. So I think that's the biggest one. I did have notes. The resources, funding constraints, sometimes transportation. I can go out into these community partners that are out in Boone and Kenton County, but we are in Campbell County. So some of the participants that we have don't have access to transportation. They don't have a bike, or they don't have the capability to walk as far as they need to go to get to Newport. It was also the stigma, the social isolation. Sometimes people don't want to walk into a peer and have other people see them to think that they're going to get some kind of reputation or get bad mouth or treated some kind of way. So,
I'd say at Sun and also working in other previous agencies, funding is always going to be a number one barrier typically, and I hate to say it, but it typically is. Also with Sun, I'd say high medical acuity. Someone with some that can't really, maybe they're in a wheelchair, maybe they're in a walker, things like that, things of that nature. It's hard to find places for those people to go to when they leave, when they're discharged from Sun. Like when someone goes to treatment, they say we start working on your discharge planning as soon as you get there. At Sun, when someone comes to Sun, they're not going to be there for a relatively long time. We're an acute level of care. So we're there to detox you and hopefully separate you from drugs and alcohol, show you some ways and means to get sober, and then if you want to do an outpatient with us, you can stay with us, but things of that nature. But we really truly do start working on discharge planning as soon as they get there because we have to. Someone with high medical acuity right now, it's kind of hard to find places. And also, during the winter months coming up soon, places are filled and always filled, right? Because it's cold outside. People don't want to be out in the cold, which is understandably correct. And so just the availability sometimes can be disheartening for people, you know. So that's some of the barriers that we do face at Sun, besides just funding, is, you know, people's medical acuity as well as availability in some months throughout the year.
I would say I agree with my colleagues up here, and I would add, you know, Medicare does not fund for residential treatment, and we serve many older adults now. We're seeing a higher percentage of people we're serving that are older adults, and that's their primary insurance. I think we still see some limitations with some grant funding that will pay for a particular type of substance use disorder. So we have some limitations there as well. I think as far as we're concerned, we build it into our budget every year. We never turn anyone away for their inability to pay for treatment. So that's been kind of a foundation of transitions for the 56 years that we've been around. I think we've also done a lot of great work over the years to reduce the barriers for people who are medically fragile. So we have an on-site primary care clinic, an on-site dental clinic. We have a nursing team. Medication available. So we have done a lot of things in order to be able to accept people who do have more medically complicated issues. We've had people in treatment that are on chemotherapy or are waiting for transplant. So we are doing a lot of work there that we can say, come on in, that's not a barrier. So I do feel really proud of the work that we've done. But I think there's also, the stigma is always a barrier. We're continually educating people, and being here and educating you as service providers is part of that. Making sure that our local churches are aware that we're here and that there are great resources in our community. There is not a wait for a residential bed in northern Kentucky, and there are certainly places in the country that cannot say that. So I think we have a lot of good things going for us as a region. A lot of us are already working together to eliminate any of those barriers, but it's certainly something that we're working on every day.
So I think for our organization, for PAL at least, you've heard stigma, 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 and that is true. But on the parent side of things, shame is a big thing. We're embarrassed. We don't want to admit. We're in denial. And so I think that's one of the biggest things, I think, that keep people from walking into that room. One thing I think that sets PAL apart from maybe some other support groups is that we are free. It is a free support group. We don't charge, and we are faith-based. We do believe in the power of prayer, and we do a lot of that, believe me, in our meetings and at home. But we also do an educational piece that we have 15 lessons that we go through. They've been developed a lot in conjunction with AA, so our recovery kind of mirrors our loved ones' recovery too, in that we have to be reminded and be repeated a lot of what we need to do. But there's something to be said about teaching families to be healthy helpers. I absolutely detest the word enabling, and my husband brings it up at every meeting and reminds everybody that I hate that word. And we're all enablers, but if you can learn a healthy way, a better way of helping, it just makes sense. And somewhere along the line, in the last 10 years of doing these meetings, even with our own son, He did not start to get better until my husband and I got better. Once we got better and started learning some things, and just things, we have things we call gems and nuggets. They're just quick one-liners that you can say because they're calling us when we say, you know, it's hair on fire, I need this, I need that, what are you going to do? And they catch us off guard. And if you have a one-liner that you can come back, or so many times I've heard from my son, you know, that he needed this or he needed that or he didn't feel good. And I could say, you know what, I'm not a doctor, I can't fix you, but I do know somebody that can help you. So things like that, just being prepared. And the biggest part of that is you guys, these families just need to know that you are not alone. And you do not need to be ashamed. Addiction gets them all. It doesn't care what religion you are. It doesn't care if you're rich or poor or how big your house is. It comes to visit a lot and everywhere. So as far as that, I think that would probably, these kind of situations, getting the word out is our biggest help. We are advertised a lot through all the messengers in the Catholic churches, and a lot of the Christian and Baptist churches know of us. So just getting the word out, I think, is the biggest thing.
Thank you. Thank you very much. So looking at just so many different people in the room, different organizations, how can local organizations collaborate more strategically to address any of your unmet needs or reduce some of your barriers?
So if you guys weren't aware of this, SUN actually stands for Solving Unmet Needs. I was not aware of that until I actually started working for them, and I've been sending referrals to SUN for years before I started working for them. But I think, honestly, in the Northern Kentucky region, we collaborate pretty well. We really do. Like I've worked in other areas of the country, and a lot of them didn't collaborate as closely as we do here. We really do. Like I know at SUN, we have Life Learning Center that comes every Monday. We have the peer that comes every Monday to talk to our patients about their programs and stuff like that, to offer them support. We collaborate very well at transitions. We have Al-Anon and PALS pamphlets outside of our front lobby for families that bring their loved ones in. So we collaborate very well as far as a whole, I think, personally, in Northern Kentucky. What we can do better is talk more. You know, I would say that. Like, I'd love to get some more phone calls from you guys, you know, and things of that nature. But collaborating more on that end, as far as as far as the substance use side, I think we really do pretty well in this area as far as that. Even with our neighbor across the river in Ohio and Cincinnati, we collaborate with them pretty well too. From my personal opinion, I haven't run into a problem so far working with SUN where I couldn't find help for somebody. Maybe they weren't a good fit for SUN. Maybe they've already been sober for a couple weeks. They need to go to RTC. They need to go to GLC. They need to go. Maybe they didn't have the right, insurance policy to come to Kentucky. Maybe they have Ohio Medicaid or Indiana Medicaid, things of that nature. I've always found that in this area, I can call somebody and pretty much find a placement for them pretty quickly. Maybe they need help with bus passes, things of that nature, stuff that the peer can do. I can send them down there as well. So, like, we have a lot of resources in this area, and it's pretty incredible sometimes when you think about it, like all the amount of resources that we have that weren't here not too long ago. And I got sober in 2018, and it wasn't as prevalent as what it was as it is today in just that short amount of time, just less than 7 years. So, yeah. Who's next?
One of the experiences that I've had since I've started doing outreach back in May is if I get introduced or find out about any other facility, besides SUN and Transitions and Brighton and GLC, like, we definitely support them. But if I find out about anybody else, such as one of the experience was with Ethan Health, if I find out about that, I will bring them into the office. I will have them tell us all about exactly what they're doing, just so that our peer supports can feel comfortable saying, hey, we know this person who works at this place. We feel comfortable with introducing you to them or telling you that it would be a good place to go. And because of all the peers having lived experience like we have, we are definitely big supporters of all the facilities within Northern Kentucky. And we do everything that we can to really put all of the other names out there, get connected with everybody. And I think that's one of the biggest things is just community outreach and getting everybody together that really, brings things together.
I agree with my colleagues. I think we've done a really great job around substance use disorder and addiction in Northern Kentucky. A lot of you have been part of that. I'm at some other tables and see a lot of familiar faces. I think we've done a really great job. That's not to say we can't always get better. I still go to places and I find that people have never heard of transitions, and we've been around 56 years in Northern Kentucky, and so it's our responsibility to always be out in the community and make sure we're at events like this so that when people present to your organization, you know that there's a resource like Transitions around. And I mistakenly did not introduce my colleague who's here with me, which is John Long. He's a recovery manager for us at Transitions and works actually out at the residential treatment center. And one of the things I would encourage you all to do is it's always easier to make a referral to treatment if you've actually been to the facility and seen what it looks like and you've met some of the people. It's a very hard thing for somebody to show up for any of our treatment. And so if you as the service provider can say, I've been there, I've seen that facility, I've seen some of their people, I've met their team, it's a good place, and I think that you would do well there and that you would like it. Or if you want to bring them for a tour, maybe they're not ready to come into treatment. We're open to all of those things. John and I both have business cards and brochures in the back, but I think some of that is how you all could help us break down some of that stigma. You're seeing people that are not, they need our services, but they're not presenting to us. They're entering through your door. And on the back end of that, I think, a lot of people, I don't know who said they were from St. Vincent de Paul, but somebody was here from there in Community Action, Brighton Center. Many of you guys we already partner with. So once an individual completes one of our residential programs or our intensive outpatient program, and they're in need of recovery housing, and it could be our recovery housing or some other type of housing, connecting them with the services that you all have is critical for them to continue along that recovery journey. So we can do so much and we provide great services, but we don't do everything, and we're certainly invested in making referrals to other providers in our region that can provide the support that they need, whether it's food insecurity or if it's needing support from the ION Center for some relationship things and counseling that they need, or financial counseling. There's just a lot of services that you all provide that would be very beneficial for us to continue or to start making referrals as people transition out of that residential level of care. Re-entering back into the community is a big deal, and we want them to be successful. We want them to prioritize their recovery, and that includes treating them as a whole person, right? It's not just about their recovery. It's also about making sure they have a safe, affordable place to live and that they have job opportunities and all of those kinds of things. So all of you guys add that value to the people we serve, and we're grateful for it.
I totally agree with everything that everybody has said up here. I will add one piece to this. Something that we see on the family side of things is a lot of the good and the bad through the court systems. I really wish that we could get a panel, and I don't know that that could ever happen, but I'd love to get some judges to just come to a meeting or listen. I would love for that side. I think they get numb to seeing this, and their assumptions that are made that families are just out there and they're just, they just keep enabling, and they're not doing what they need to do. And I would love and would invite anybody to show up at a meeting. Anybody 18 or older is sober is welcome to come. But to sit around a table and listen to very educated parents who feel like they've done everything, and they struggle with a lot of the things within the court system, and we don't get privy to that information because of, or even through the health system because of HIPAA. So we're struggling to find out. Our kids certainly aren't telling us anything that's going on. So that we hear a lot in the meetings, and we talk a lot about that. Fortunately, my husband and I have been advocating in Northern Kentucky since 2012, really, when things were not being talked about a lot. It was just starting to come to light. The heroin epidemic was starting to just really be known. And I would venture to say things are good and things are better than they were, but we still have a lot of issues out there with dealing through the court systems and dealing with trying to help get our kids into into treatment. And I said, it's interesting because as a parent, I can tell you that the best night's sleep I got was when mine was in jail. So sometimes that's where they need to be, just to get a break, for us to be able to sleep and for them to take a break and maybe get an opportunity for a judge or someone to send them to treatment when they're not willing to go. You don't know where that recovery is going to hit. It may be in a jail cell. It might be in recovery. It might be on the street. It may be listening to a peer. But if they're not alive and we can't keep them alive long enough to get there, then I consider that a huge barrier. And I'm very happy to hear a lot more talk about harm reduction, too, with some medically assisted treatment.
Thank you. Okay, so the last question, and this is probably hopefully one of the easier questions you've had to answer, is the success story. So if you can think back, whether that is just something that you can think of collaboration within the room or just a success story within your agency, if you'd like to share a success story that you have on the top of your mind.
Looked at me, so I guess I'll go. Well, I have two that came to mind when you said that. One's actually very recent. So I was at Sun, and I was part of the treatment team for our substance use units. And there was a guy that, I talked to, and he wasn't quite sure what to do next, which is familiar with a lot of people that come into, treatment. And he was on the fence about getting involved with an anonymous 12-step fellowship. He was on the fence with following up with therapy. He was on the fence about doing this, that, and the other. He was under the idea that as long as I go back to work, everything will be okay, right? Which is, if anybody who's worked in treatment knows that's not the answer. It's not going to fix anything, right? But all of a sudden, just last week, I'm in recovery, so I go to meetings regularly, and there he was, And something was changed about him. He had a little bit of weight on him again. He had a little bit of a light bulb going on. He had some glisten in his eyes, and he was not the same person in just that short amount of time on who I met in detox, just a little over a month ago. Another one that comes to mind is, who all here actually have works in substance use treatment, right? Like a lot of people, I suppose. You ever get those clients that come in there, the people that you meet, and you're like, there ain't no chance he's going to listen to anything that anyone has to say, right? Very stubborn, mule-headed type of people. And, well, this guy was one of them. And he came in there, he wasn't listening to anything that anybody had to say, but he knew I was in recovery and would have conversations with me after the groups and all that stuff that he would refuse to attend. He wouldn't attend groups. He would just talk to me after the groups and stuff. And today, he celebrated, just a week ago, he celebrated 6 years sober. He lives in Louisville, has a 5-bedroom house, has custody of all 5 of his kids, has an outstanding job, got married, has joined a 12-step fellowship and helps other people, to remain sober so he stays sober. Completely changed person from someone who was so stubborn to not doing anything, then all of a sudden something just shifted where he was willing and able to do whatever was possible just to remain sober and be happy and free. Really cool. I get to talk to him regularly. I get to talk to him all the time. And it's just a completely different person than what you meet. And that's what happens when you work in the field. You come to these people who are broken and they don't know what's going on, and all of a sudden something shifts internally inside of them, and their lives start to change in a desperate way. And it's really cool to kind of just be able to witness all of that happen. So that's all.
I would say your smile says a lot, too. When you first started talking, just the smile on your face was just...
Yeah, he was a mess. I'll tell you that. He was a mess. But he was the type of guy that with the long-term treatment 3 different times, got kicked out of 1 for selling drugs. Been at treatment 20 times probably. And finally he was, if you're in recovery, you can understand this, he was defeated, right? He didn't know what else to do. And finally turned to some people for help and turned to his own God for help. And then all of a sudden, something shifted in him, and he was willing and able to do whatever is necessary, and now he lives a full life today. And it's just really cool to be able to just be a little footnote in somebody's life and that transformation that takes place. So,
I have a lot of faces that came to mind when I read the question. And I think it's a privilege to go to work every day, because we do see people when they come in and they are very defeated and they don't know what step to take next. And we see them along this continuum of care or this journey of their recovery. And then all of the sudden, I thought of, 3 particular faces that, 18 months later, we see them and they're still in recovery. They're doing so well. They're living independently. They're re-engaged with their families, all of those things. And that's such a privilege to see and to be a small part of, because they're the one that's doing the work, right? We're providing a safe environment and resources and a really great team to give them the opportunity, but they're the one they're engaging in treatment, they're engaging in counseling, they're willing to listen and take suggestions. And so it's really a privilege to see them, progress and to accept the recommendations that we give them, that they're willing to do whatever they need to do. And so that's part of it. I would also say the other thing that came to mind is 60 to 65% of our team at Transitions is in recovery. And that's at every level of the organization. It's not on anybody's particular job description, but I think that is a thing that we're very proud of, and I believe that that's what helps us be so successful when people come in to our treatment programs and into our outpatient counseling and into our housing program, is that we have people who can meet them where they are and understand exactly how they're feeling, and I think they can offer hope, and that is what we're honored to do. So, yeah.
It's so... brag a little bit. Success stories. If you come into the pier, every single person who works there is an absolute success story, because every one of us are in recovery, lived experience. And the cool thing is, a lot of people that walk into the pier, it's like it's their first step. It's their first step to be introduced to what life in recovery can be and what the next steps can be. And it is somebody who, like, the people that work there, we get on everybody's level and we can understand where they're coming from, the fears that they have, all the questions that they have to ask. And then we can be that branch where we fill that gap between them going from either homelessness or, seeking recovery and getting them out to the places that they need to go. I am going to toot my own horn for a minute. So I started with the pier back in May, and I have not worked outreach before. And my first event was the back to school event, and I blasted that out everywhere. And I was very full of fear, scared, if it was going to turn out right. And we were able to hit 268 people in that day and pass out 200 backpacks. And we had 21 community partners table that event. And that for me is huge, because from what I have heard from last year to this year, our numbers jumped drastically. And also every month, our numbers have increased with people coming in just seeking any kind of help, support groups, or just anything that we can do for them. Also with the pier, like, everything that we do is free. We don't charge anything. We don't run insurance. And we do have people that come in and we can provide hygiene. We can provide bagged lunches, just any kind of resource that we have. And it's just, just the pier is just a success in its own. So, yeah.
So I think with us, I think back 10 years ago when we started the group, and doing it mostly because we felt like we needed help and wanted to reach out and help. But anybody that's been involved with anyone that's battling substance use knows that it is a marathon. It is not a sprint. So the fact that we're still here 10 years later, and we've still got family members, one of which I have sitting that came with me today graciously, that's been coming to this group for 10 years. Does that mean that PAL is not successful? No, it doesn't mean that. It means that because addiction is what it is, and I was one of those parents that thought the first time Eric went and got some treatment, voila, he was cured. But unfortunately, it doesn't work that way. And the fact that we're able to still be here, we're still dealing, we've probably dealt with over 500 families. I will tell you that along the way in this 10 years, we have had parents that have lost their loved one to overdose, but I still have those parents coming to meetings and showing all of us that you can get through this, you can survive, and you can still make a difference in somebody else's life that has one that's still battling, or that you're trying to help get through this. One success story that just in my mind, her son was probably one of the worst that I had seen in all of the families that we've dealt with. He did better in jail than he did on the outside of jail. He was selling, he was using, he was everywhere. He was living under the bridge, and after the PAL meetings, we'd leave and get McDonald's and drop food off to him under the bridge, so that, first of all, that Mom and Dad knew he was eating, and secondly, that Mom and Dad could at least check on him. And for Tony and I, my husband and I, that meant that we were keeping track of our parents because we were scared to death for them to be on the riverbank. So today, he is a graduate of Life Learning Center. He's got, working on finishing up a degree. He's working. He's bringing people to meetings. I honestly thought that I would have attended his funeral. But recovery does happen. It still happens. We don't see it as much and as quick as we'd like. And it can happen in families too, because I can tell you, those smiles are genuine. When you guys are smiling in recovery, we're smiling too, because we need that recovery just as much as they do.
Well, this has been a wonderful panel. I just want to thank each one of you for the work that you do on a daily basis, and everyone in this room who is working to address substance abuse and addiction, and just really thank you for just the day in and day out of how it can be, right? With a step forward, 2 steps back. But thank you very much. Would everybody give them a round of applause for preparing? We have, I don't know what time it is. We have some time for questions. Anybody have any? Yes, Aaron?
Yeah. The Addiction Helpline is part of the Northern Kentucky Office of Drug Control Policy. I thought maybe somebody was here from there. I can certainly get you connected to them. I don't obviously have all their contact information on me right now, but I'm happy to connect you. And that is a resource in our community where people can call and get rides to different places. They keep a plethora of information about all of the services that we provide. So if somebody needs a resource, they have all of that, and they can make referrals. So that's what I know about that. CARES is a community collaborative. There are several of us that are partners in that group, including our colleagues at St. Elizabeth, the Northern Kentucky Office of Drug Control Policy, North Key, Sun, Transitions, and I feel like I'm missing somebody. Life Learning Center, thank you. A big one. I was missing a big one. And so that is a collaborative effort in our community that was funded through opioid abatement settlement funds through the state of Kentucky. And those resources enable us to really have a no wrong door entry into addiction and recovery services. So you can present anywhere and get an assessment and get referred to an appropriate level of care. And then, of course, the individuals that once kind of they're through that treatment, whatever level of care that is, they can then attend the Life Learning Center and the reentry resources that they provide in our community. So there are a lot of different aspects of that, but the grant was originally created to serve individuals who were really high utilizers in our community, so people that were frequenting the emergency department, regular incarceration, people showing up at treatment over and over and not having successful outcomes. So that grant was initially funded to target those individuals, and so we're still in the middle of that going on in our community. Does that help?
Thank you. Any other questions? Anybody or comments that you'd like to share? Ask? Yes, Lisa. Thank you, Lisa. Anyone else? Well, yes.
Go ahead. I know through Sun is typically through employed only because we deal with, we're an acute level of care hospital. So yeah, I know through Sun that would be a little different, yeah.
We do have opportunities for people to volunteer, but like Sun, there is the clinical component, the licensure, the credentialing that we are, accountable for the individual and group counseling that we do. We do have some volunteer opportunities for other ways to engage and serve, especially people coming in around employment support or things of that nature, or might just want to come in and serve a meal, things like that. We can absolutely offer those opportunities.
Sorry. We do have some volunteers who come in and help at the pier. I have reached out to some people that, like other facilities or sober livings, that when I've had an event, if they would come and help set up the event, help tear down, help take out trash. But we do have some, but that is something above my, But it is something that we do have.
Yes, and I'll just throw that out there for PAL too. PAL's always looking for facilitators. As I said before, they provide all of the training and the program or the paperwork, anything that you would need to do that. Once you find a location, you can address that. And I would say that right now, last count, PAL is in 38 states, so there are lots of meetings all around. You can actually go to palgroup.org and put in a city and find a PAL meeting, but we certainly need more. At the height of the heroin epidemic, we had 11 meetings in northern Kentucky. As of today, there are 2, and they are both the ones that we facilitate. So we are always looking for facilitators. The only requirement for that is that you are a parent on this journey. They do require that.
Thank you. Thank you for asking that question as well about how we can give back, right? There could have been a lot of people in this room sitting on that panel, lots of different organizations, as we said, doing the hard work. And hopefully next year we'll have a different panel and we'll get different perspectives. But again, thank you guys. If there are any other questions, no questions, we'll move on to announcements. Okay. Does anybody have an announcement that they want to share? I can go first since I got the mic. October 23rd at Holy Spirit Parish in Newport from 5 to 7. Huh?
Thank you, guys.
Huh? 5 to 7 p.m. There will be a community baby shower that's hosted by the Pregnancy Care Network, open to anybody. They give away some big car seats, strollers, big ticket items, diaper bags, clothes, all kinds of things. So if you are working with anyone who is expecting or has a newborn, please invite them to come to Holy Spirit on Holy Spirit Parish Center on the 23rd from 5 to 7. Anybody else have an announcement? Somebody who was like one, two.
I just want to remind everybody that open enrollment for healthcare begins November 1st through December 15th.
Vicky's favorite time of year. I have an announcement. Maybe you guys saw our email yesterday. We finally announced to the public that we'll be opening our free clinic in March of 2026. We're changing our name to the Faith Community Health Network. Our clinic will be serving uninsured people throughout northern Kentucky. It'll provide primary care, urgent care, chronic disease management. It will have a full CLIA-waive lab, so somebody will be able to come to us, meet with a healthcare provider, get their labs drawn and read and diagnosed all at the same time, and walk out with a prescription. So we are extremely excited about it. So keep an eye out and spread the word.
Hi everyone, it's Grace Marie Thompson with Building Community Wellbeing with Brighton Center. I sent out an alert one of the days this week or last week, specifically talking about engagement unpacked. We are inviting a lived expert turned professional from Central Kentucky to come and lead a 4-hour training on how you can utilize lived experience both in your organization and making sure that if you do have lived experience, that you can utilize that professionally. It's about a 4-hour training, and it's next week. So please come out. It's a really great experience. And we're talking specifically about her engagement with the child welfare system, but she has a ton of different experience that is very applicable to all the different organizational work that we do.
Anyone?
Every time, right? Okay. I don't know what that is, but okay. I'll say this. So when our Safety Net Alliance moved to this space here, we reached out to Matt Westwood, and he's the reason we are able to meet in this great space. Matt and his wife Jennifer host the Chelsea Ryan's Festival of Hope. That is this Sunday, which is at Lloyd Memorial High School in Erlanger, 5 to 7. This is a fantastic festival that occurs to encourage mental wellness, 2 to 5 on Sunday. It encourages mental wellness, and it also prevention of suicide, and any funds that are raised from that very fun event go to help students and other groups throughout Kenton County to encourage mental wellness. If you have any opportunity to go to this fun event, they'll have food and music, bounce houses, it's lots of things for families. I would strongly encourage you to do that. The other thing I'll mention to you really quick is on October 31st, Halloween, 9 to 12 at CTEC. St. Elizabeth will host their 3rd annual Mental Health Summit. That's coming, and there's plenty of room for every community partner. We strongly encourage you to come, and Jessica's going to finish the rest. There you go, Jessica.
Hi, Jessica Green, law enforcement navigator for Kenton County Police Department. Some know what I was about to say, so my old role. Just want to let everybody know, Trunk or Treat is tonight at Kenton County Detention Center from, I think it's 6 to 8.
Jeremy Boer, Boone County Schools. I've been busy because I'm one of the DPPs and getting back in school. So just a reminder, I am the liaison for Boone County Schools over all of our family resource youth service community members. So starting in January, because we're full, the 3rd Thursday of each month, we have our district-wide meeting, which we have 20 coordinators of our 27 schools. So some of you all have already met with our coordinators and presented on what you all have, what services you all offer. So if you all would like to present, usually we could take 2 presenters per meeting. Like I said, we do the 3rd Thursday of each month. We're booked all the way to the end of the year, but starting in January, we have openings through the end of the year. So just come see me. I'll give you my business card, and then you can present anytime from January to May. We're looking for presenters to talk to our coordinators.
Thanks, man. Thanks for being here.
Hi, I'm Maggie Linott, and I'm with St. Elizabeth Healthcare as well. And Lisa covered 2 very important events that are coming up, but there's another one that is for, it's in celebration, it's a no-cost event in celebration of World Diabetes Day on November 14th. No cost, and vendors for diabetes-related vendors will be there, health screenings, lots of opportunities to come down and get anyone you know down there to get connected to important resources. So
St. E. Covington? St. E. Covington?
St. E. Covington at the Regional Diabetes Center.
We'll be there.
Anyone else?
I was going to ask you while I was standing there.
I'm Larry McNabb, and I'm a master trainer with the QPR Institute and founder and co-facilitator of our Christian Survivors of Suicide Support Group at First Church of Christ in Burlington. But on November the 18th, right here at Lakeside Christian Church, in collaboration with Chelsea Ryan's Festival of Hope in the Westwoods, I am doing a biblical-based QPR suicide prevention training that's open to anyone If you go on Lakeside Christian Church's website, you can register for that. There may be, in the lobby, there may be some cards that has a QR code, but that is free for anybody that wants to attend, and that's November 18th, 6:30 to 8:30, and it'll probably be in the main auditorium.
Okay, anyone else?
I have one more announcement.
Okay.
We always have extra pizza at the end of this, and if nobody takes it, then it just goes in the trash. And I know some of you are going back to places where people could eat pizza. So please, at the end of every meeting, take whatever you want off of that table so that we don't have to throw it away.
Okay, any other announcements? Last call, last chance. Okay. Well, then, thank you for coming today. I hope that you enjoyed your time and learned something new, and we will see you next month.